Hi.
Hi.
My name is Sandy.
Ask the patient's name and compare to the lab requisition. Ask the date of birth for confirmation of identity.
Have you ever had your blood drawn before?
Sure.
Do you have one arm that's easier than the other?
Oh, yeah, the left one. So I figured I'd roll up my sleeve for you.
Hey, thank you.
If the patient says that he may faint during the procedure, place the patient in a semi-reclining or supine position on the exam table. The patient's head may be raised for comfort. Put on gloves. While you are learning, you may want to apply a tourniquet and palpate the veins of both arms. Then remove the tourniquet while you clean the site and prepare the safety needle and holder. Apply the tourniquet so that it is tight enough to prevent venous return, without being so tight that it interferes with arterial blood flow.
I'm just going to put a tourniquet on.
Sure.
The friction on the elastic will hold it in place, and you can quickly remove it when you're done. As a learner, release the tourniquet while you clean the vein and prepare your equipment. Identify a suitable vein and use an antiseptic wipe to clean the site. Working in concentric circles from the inside out, making sure not to backtrack. Allow the site to air dry with the tourniquet off, or dry it with a sterile gauze square.
Make a nice tight fist.
This prevents stinging. After assembling equipment, place the first tube loosely in the holder. Don't puncture the stopper or you'll lose the vacuum. Anchor the vein with your non-dominant hand by grasping the patient's arm 1 or 2 inches below your target point and pulling the skin taut. Position the needle with the bevel up so it follows the direction of the vein. Smoothly pierce the skin. Enter the vein at a 15 to 30 degree angle. Grasp the holder firmly and use your non-dominant hand to push the first vacuum tube onto the short needle in the holder. Let the blood flow into the tube until the vacuum is exhausted. Hold on to the holder and needle firmly while you remove the first tube and repeat the process with the next tube. When the last tube is filling, remove the tourniquet by pulling the short end upward. This will help prevent pressure from forcing blood out of the vein when you remove the needle. Remove the last tube from the holder and mix the blood by tilting. Apply pressure to the site with a sterile gauze pad and activate the needle safety device immediately after you remove the needle. Discard the needle and holder in the biohazard container. Have the patient hold the gauze over the puncture site as you label the tubes. Label all the tubes with the patient's name, the date and time, and your initials. Some offices will have pre-printed labels. If the specimen will be sent to an outside lab, insert in a biohazard transport bag and seal it.
Okay. And I'll just give you a little Band-Aid.
Cover the gauze square with a Band-Aid after checking for bleeding.
There you go.
Perfect.
You're all set to go.
Thanks very much.
You're very welcome. Get that out of your way.
Remove and discard the gloves and sanitize your hands. Write the time you collected the specimen and your initials on the requisition and place it in the outside pocket of the biohazard transport bag.